Welcome to another edition of Toyo's Talks, where I bring in interesting people to talk about a particular subject. Today, we have the honor of having Dr. Jack Fisher, one of the pioneers of hair restoration. He's a board-certified plastic surgeon. He retired 3 years ago, but he's going around and teaching other doctors still the techniques and the good techniques for hair restoration. Him and Dr. Melissa Toyos are having a teaching seminar in Nashville in a couple of weeks. He's the past president of the American Society of Aesthetics Plastic Surgery. He just received a Career Lifetime Achievement Award at their meeting. Jack, thanks for coming out. We had a great dinner with Jack a few months ago, and I learned so much that I decided to bring him on to the podcast and just pick his brain. So how long have you been doing this hair restoration?
So I started practicing plastic surgery in 1980 after finishing my training at Emory. And then around, I think it was 1991, I was at a meeting in New Orleans, and Dr. Carlos Ubel from Brazil was presenting some incredible results from hair restoration. And I had never been interested in it because I didn't think the results were very good. We all remember the horrible hair plugs and some of the other results. And all of a sudden, I saw somebody presenting what looked so natural, you couldn't tell they had a hair transplant. And to me, the key of a good hair transplant is no one should ever know you had one. Mm-hmm. And so I got so excited, I made a trip down to Brazil. And I actually made a couple trips. And then Carlos came up and taught here. And then for many, many years, I did teaching courses at our national meetings with Dr. Ubel. Brazil, interesting country. It has the second largest number of plastic surgeons after the United States. Aesthetic surgery is very important in their culture. And the other thing is, unlike some people I'm talking to, going bald is not acceptable because hair is very important in their culture. And so they always were one of the leading pioneers in hair restoration. And so I was very excited to start it. Now, remember, back then, this was just the strip technique. Yeah. We didn't have what we're going to talk about, follicular unit extraction, but at least the results were superb.
So what was he doing differently what was he doing differently than others weren't? Like, what were the specific techniques that he was showing you and that you could bring to the U.S.?
Yeah, so that's the key question you just asked. As opposed to the unsightly plugs that had 10, 20, 40 grafts per plug, he was doing things the way nature grows it. And that is that hair grows in 1, 2, 3, usually units called follicular units. And he was actually cutting the grafts into the follicular units. And that was the key game changer in hair restoration, is all of a sudden starting to transfer hair the way nature intended it to be. And that's what got me so excited. So I came back and I started doing it a little bit. And then over the years, it became more of my practice. And I was lucky. I trained my nurses in the technique. And we developed a really good team, because this is not a procedure that one person does. When patients ask me, why are all these other people here? I said, because that's the only way you can do a hair transplant. Yeah. If you'd like me to do it all by myself, we probably won't live long enough to finish the procedure. Yeah. And then you educate patients, which is so important, that it is a team procedure. So eventually, 5 years before I retired, it was such a dominant part of my practice, I decided to finish my career just doing hair. And that's what I did for the last 5 years. And I really enjoyed doing that. And I had built up a good hair practice by then, that it was something that I could just focus on.
Yeah, what was the major changes that you've seen over the course of, since you started in the 90s to now? What would you say the three biggest changes during that time that you've seen?
Yeah. So one, obviously, follicular units. The other problem, as you know, is the strip method is a good method, and I did it till the end of my career, but I became very selective because follicular unit extraction, which we're going to focus on, especially a device like the SmartGraft, is it avoids that linear scar in the back. And that really was another game changer, because actually it was my patients that drove me into it, because I had people showing up in my office saying, I don't want that scar on my back. And matter of fact, because we're close to Fort Campbell here, I would see military individuals, and they wear their hair so short, there's no way they would tolerate a linear scar. So a big part of it was patient driven. And then the next and final step was the technology. I always point out to patients, the technology doesn't do a hair transplant. The team does the hair transplant. But the key is using the latest technology. And when I started doing follicular unit extraction, which is just using a tiny little device to harvest individual follicular units, I used a device. One was called the Harris device. It was a handheld, basically little drill. And it was difficult for me. And I wasn't getting the results I wanted. And then the technology really made a major jump with the automated systems that came out that allowed you to harvest large numbers of follicular units and do it reliably and have good grafts, because you should have 90% plus usable grafts. And with the people you work with today and the technology, it's probably even greater than that.
Yeah, you mentioned the SmartGraft. Tell us about that.
So what it is, it's one of the automated systems. And what it does is think of in the old days, we used punch grafts to take out, 10, 20 hairs at a time. And those look terrible. This is a little tiny miniature rotating drill bit, essentially, but it's hollow. And it's anywhere from 1.0 to 0.9 millimeters in diameter, which is what matches a natural follicular unit. And that's the key, is you're using a device that matches our own hair. And so when you do that, you are automatically getting natural grafts. And so the SmartGraft is doing that. The other benefit of the system is that it also keeps the grafts moist and cool. One of the things that is the most injurious or risky thing to grafts using any technique, whether it was my previous strip or today's modern techniques, is desiccation, drying out. Yeah. Once a graft dries out, there's no bringing it back. There's no religious procedure that will bring a dried out graft back. It's gone. Yeah. And keeping them moist and also cool at the right temperature helps preserve the grafts, because from the time you start harvesting it to the time you start implanting it is always going to be an hour, 2-3 hours. And the nice thing about hair, it's very resilient. There have been studies done years ago where they showed how long a hair follicle can stay outside the body. And as long as you keep it moist and cool, it's still good. everyone's familiar with kidney and liver and other organ transplants. You have to be particularly careful with those organs because they deteriorate so rapidly. We're fortunate. Hair is very, very tolerant of being outside the body. But again, as long as you keep it cool and moist, it can go literally hours before you replant it.
Yeah. Tell me about a little bit about hair loss. And we were talking about it before we got on the podcast, but give us a little insight into hair
Sure.
loss.
So there are two major drivers of hair loss, different in men and women. The number one factor in men is genetics, but it's a very mixed bag. My father, his two brothers were bald in their early 30s. Both my sons, who are in their early 40s, are cue balls. But their father still has the same head of hair he had in high school. So you can imagine nobody in my family likes me. But my maternal grandfather died with a head of hair like mine. But it's a misnomer. You hear people say you inherited from your mother's side. That's not true. Like a lot of traits, it's a multifactorial trait. Height, there's so many traits that we have as human beings that are really multiple genes, and hair is that. So when the dice were rolled, when Jack was created, Jack just got the right set of genes, and he still has an incredible head of hair. So I have to apologize to my family all the time.
Well, that's
But
actually,
yeah.
did your kids growing up, they started losing their hair? Did they come to you and ask you what they could do?
Yeah. Well, I told them to get a lot of money because it's, they needed to pay for it, but actually not. My poor sons started losing their hair so early that it became obvious it wasn't a viable procedure. And this is critical. One of the biggest mistakes I see is doing a hair transplant in individuals who are too young and also who have a strong family history of hair loss. Throughout my career, I was very conservative who I did a hair transplant on in young men. If they came to me, I rarely did it in anyone younger than, let's say, 25. But even then, if they came to me and said, well, my brothers, my uncle, and my grandfather were all bald by 30, I tell them, take your money and go to Hawaii on a vacation.
Yeah.
Because you're not going to be happy with a hair transplant. And at one time, 25% of my practice was redoing bad hair transplants. That was a big part of my career. I've written several book chapters on redoing bad hair transplants. And one of the most common causes was getting it at too young an age and then going bald and left with a funny appearance. So one of the critical things I always teach is patient selection. But genetics is a big, big factor in men. Now, there are other things that influence it, but if I had to pick the one thing, it's genetics. Women, it's different. It's either hormonal or it's metabolic. Matter of fact, the number one cause of hair loss in women are things like thyroid disease or autoimmune diseases, rheumatoid, scleroderma, lupus. All of these lead to hair loss in women. And so it's a very different phenomena. Now, there are also a subgroup of women that have genetic pattern hair loss. And I could make the diagnosis when they walked in the door. They're a very different group. It looks like male pattern hair loss. And these are extremely good candidates for hair transplantation because they've got a very specific high hairline. They lose their temporal hair, it recedes. But the key is almost all of them have beautiful donor hair, because that's the other thing we need to discuss. If you don't have wonderful donor hair, the procedure doesn't make any sense. And that's one of the most important things when you evaluate a patient. whether they're male or female, do they have good donor hair?
Yeah, one thing that we talked about at our dinner is you were saying for young people, and let's take that young person that is not a good hair transplant patient, but you were saying in those young people that you were doing PRP injections.
Yeah. So I got very comfortable with PRP. PRP got a bad press for a while because it wasn't being used properly. I saw patients who were essentially bald getting PRP. I mean, that's kind of the Lazarus effect. It isn't going to work. But where I found PRP extremely useful, especially in young patients, is delaying the hair loss. And I would tell them, you know, the one thing that really bothers, let's say, a young man in his early 20s, he's starting to go bald. He feels like everybody thinks he's a lot older than he is because we associate hair loss with aging. And the one thing I got very comfortable with is telling them, look, eventually your genes are going to take over, and I can't stop that. But I feel comfortable with something like PRP, and there are other treatments available. I can slow the process down, and I probably can slow it down for several years. And they were very interested in it. And I started out very conservative with those patients. They were very happy. And if I could give them 3, 4, 5, whatever years of maintaining some of their hair, they felt it was absolutely worthwhile. So the key to anything like PRP and some of the other treatments that are now available, it's patient selection. It's always patient selection.
Yeah, you look in the internet now, and I want to get your opinion on this. With shampoos, like, there's all these different advertisements. Oh, this shampoo will save your hair, and I use this shampoo, and I saw something today. Rubbing onion water on your head will keep from losing your hair. So what do you think about any topical?
Years ago, there was a guy on the internet that promoted coming to him and having his cow lick your head. And he guaranteed that if the cow licked your head, you would grow hair. Probably no other area of aesthetics has so much garbage out there as hair. And part of it is because it's such an impact on both men and women. Here's the thing about shampoos. There's no shampoo that really grows hair, but there are shampoos that can have a negative impact. There's a product called sodium lauryl sulfate. And when you wash your hair with a lot of products, they have sodium lauryl sulfate in there because people like suds. And they think that sudsing phenomena is what's cleaning their hair. It's not. But there are several products out there that don't have sodium lauryl sulfate in it. And I always recommended those to my patients. But other than that, there are topical treatments that can help hair. Rogaine is for real. But the problem with Rogaine is, again, it's oversold. Only a certain percentage of people respond to Rogaine. One of the things, there's Rogaine for men that's 5%. And you'll see another product out there, Rogaine for women at 2.5. You never want to use that. It's not very effective. I always tell patients, if women use Rogaine for men or 5%, and the reason is it's more effective. The reason they came with a weaker solution is women were growing some facial hair because they weren't washing their hands. And it's key that after you apply the Rogaine, for women, wash your hands. You don't put Rogaine on your face. But 5% is critical.
That's interesting you said, because and this keeps coming up in my space, testosterone cream for dry eye disease. And every time it gets studied, the only thing that you see is that women will grow hair in places that they don't want to grow it. So they'll grow hair on the eyelids, but not eyelashes, just random
right.
So, you know,
or hair on their chin,
yeah, hair on, yeah,
or nasal hair. Yeah. Testosterone treatments for women has become more visible. Matter of fact, years ago, I had several female bodybuilders,
yeah,
and it was very interesting because of their testosterone use. They were also losing hair on their head, like their fathers and the male men, because what it was driving them is to that genetic pattern of hair loss. So I think it can be used, but you have to be very, very careful. And it varies so much from patient to patient. Some women are sensitive to it, and it probably has to do with genetic patterns, and some women are not. It's very unpredictable.
yeah. And so hormonal creams are not going to be a future topical for hair loss.
Probably not. An interesting phenomenon, whenever I teach my courses, I always point this out to people. If we all live long enough, grandpa starts looking like grandma, and grandma starts looking like grandpa. Why? It's because the shift in hormones. As men get older, their testosterone levels drop, and we all men have some estrogen. So they get feminized. And grandma starts growing facial hair because of the testosterone. So it has an amazing influence, but it's not like it's necessarily something that positive that we can use. If you don't have testosterone, men don't lose hair. I always told patients would say to me, how can you guarantee I'm not going to lose my hair? I said, well, I can do that, but I don't think you want your testicles removed. That probably would not be a good procedure. But the point is, all kidding aside, you have to have testosterone in the male system as far as losing hair.
Yeah. What do you see for the future? You see anything besides SmartGraft that you mentioned that as like one of the biggest advances? What would be the future? We're talking about all this genetic manipulation and all these stem cells and things like that. Any of these going to be
Yeah.
here?
I think stem cells and help me, I lost the word. What's the other thing that's
There's
getting
exosomes and peptides.
exosomes? Yes. I think they all have a future. I
Yeah.
think as we get more sophisticated with them. I have a very interesting case. I used to do a fair amount of pediatric hair restoration, burn children, children with trauma. It was always a very enjoyable part of my practice. And years ago, I had a young man who had lost a little bit of his scalp. And I couldn't do a hair transplant because the tissue was so thin. So, what I did in several of these children, I injected fat from their stomach under the scar and into the scalp to allow it to rejuvenate and thicken. And we've learned through many different procedures the benefits of fat. And he went away for a year and he came back and he was growing hair in the area where I injected the fat. I hadn't done a hair transplant. Well,
Yeah.
what simply happened? The stem cells in that fat all of a sudden activated some dormant hair follicles. It was quite prominent. And there are people around the world that have had similar experience where they're promoting stem cells. I think exosomes has an incredible future as we learn more and more about them. I think we're still in the very early phase of understanding exactly exosomes. But remember, the majority of patients, by the time you see them, they've already lost a significant amount of hair. And if there's no hair in an area, very little chance any magic is going to start growing it. It's an interesting fact. If I did a biopsy and I use you as an example of your areas where we don't see hair, there's still follicles there, but they're very small and they're inactive. So it isn't like the follicles are completely gone, but they're no longer functional. And I think once the follicles reach that level of dormancy, probably very little is going to bring them back. And that's why hair transplantation is always going to have such a big component of hair restoration, because we need to move hair around.
Yeah. And then it sounds like you have to do it quickly. So if somebody has, like, is there a period of dormancy, and then eventually if that hair follicle is dormant for a year, then it just kind of disappears, or do you have a time frame?
Yeah, so you raised another important question. We use in hair restoration what's called the Norwood classification. It's 1 through 7, and it just simply is the degree of hair loss. And so what you have to do is be very careful. If somebody comes in and they're 33 and they look like a Norwood 2 or 3, you know you're going to have plenty of good hair. But let's say they come in and say everybody in their family, like I said before, was bald by the time they're 30. The problem is you run the risk of moving hair that looks good right now and transplanting it, and they have good hair for a few years and then it's gone. Yeah. So that's why patient history is so important. So you have to be very careful when you're doing a hair transplant that you're picking hair that you think has a long period of viability. So that's a very good question. You want to pick hair that you think is very good. And that's why we tend to use the hair in this band in the lower back. And the reason is very few men ever lose that hair. Some do, but the majority of don't. So going into those zones where you know the hair has longevity, that's one of the key components of hair restoration. Yeah.
One of the things that we're seeing in general, just in all of our different clinics, whether it's aesthetics, dry eye, general ophthalmology, is vitamin and mineral deficiency. And we're seeing it more and more. And I think it definitely is affecting hair. Did you ever delve into with patients their diet and get in supplements?
Absolutely. I shouldn't do ads, but I used Nutrafol for years, and I feel that there are other products out there, but it's got a good collection of those things that are important. Diet is critical. I mean, that's why people who suffer from malnutrition lose their hair. Hair loss is such a complex thing. Stress is a very common cause of hair loss, but nutrition is a major factor. And there's no question, I saw patients who got good responses from going on supplements and really a good diet. It's critical.
Yeah. And then eyebrows. So you see patients as they get older, they lose eyebrows. That's just the same thing as pattern baldness.
Yeah, great question. It's so unpredictable, eyebrows. Yeah. What I see, and you all are very good at this. I did some eyebrows, but I never got that great at it, or eyelashes. But especially in women, as they get older, it'll be the lateral portion of their eyebrow will start disappearing. Usually the medial or inner part stays there. But what they hate is the sides of the eyebrow just kind of disappear. And that's where I think you have a great opportunity of supplementing that. Now, doing a eyebrow hair transplant is technically very demanding. It's the hair has to be put in at the right angle. There's a lot of components in doing a good eyebrow hair transplant. Otherwise, it can look very strange because eyebrow hair is very unique. The other thing when you do an eyebrow hair transplant, you have to inform the patient they're going to have to trim it periodically. Yeah. Because our eyebrow hair doesn't really grow or grow very much. But when you take hair from the back of the head or the sides and supplement it to an eyebrow, it's going to grow just like the hair on your head. So yes, it's very important that they understand that. And sometimes not all the hairs grow in the right direction. Sometimes you have to pluck them. I always found that sometimes I had to do at least 2 procedures to get a good result. Actually, my eyebrow experience was more in the trauma side than the aesthetic, because again, I would be referred patients who lost part of their eyebrow, like after a car accident or something.
Yeah.
And those are easier to do and often easier to match.
Yeah, I think Dr. Melissa's practice, that's the one part that's growing the most is the eyebrows for women.
I think that's great. And you know, if you have, remember, most hair transplant surgeons, the majority of their patients are men. Although I had a substantial female practice, but 15% of my patients were women. I think what you all have going for you is a much higher concentration of female patients. And I think that gives you a greater opportunity to do eyebrows. And the more you do eyebrows and the more experience you get with it, the better the results.
Yeah, just experience builds on experience, and then you get,
absolutely.
Which leads to the last question, and you kind of started with this, and I want to kind of end with this, is that it seems to me with hair restoration, there's an artistic part to it, because you said in the beginning of the pod that the best hair restoration is one that you don't know somebody had hair.
Exactly.
So what artistic, there has to be a little bit of an artistic, or is it a scientific view of how the hair pattern should be to make it look natural?
It's both, but a lot of it is art. I personally get upset when I see a lot of bad hair transplants out there. If I can tell somebody had a hair transplant, it's not a good one.
Yeah.
I'll never forget, I was at a wedding many years ago, and one of my colleagues was teasing me about doing hair. And I said, okay, 3 of my hair transplants are attending the wedding. I'll give you $100 for each one you find. So he went looking around everybody's head, never found them. But the other thing that I teach a lot of is designing an age and gender appropriate hairline. Yeah. I see a lot of hairlines that are just terrible. And the reason is they don't understand what a natural hairline should look like. Yeah. And I think that's one of the most critical things for people when they're getting a hair transplant. Get someone who knows how to do it based on your facial aesthetics, the contour of your face. Also, racial qualities are extremely important. There's big differences in hairlines depending upon not only race, but family history. And so bringing all these things in, once you got the technical part down, you got to be able to do that. But then the other component is that sense of aesthetics and knowing how to create a totally natural but appropriate appearance.
Yeah. Yeah, I can remember being on a plane coming back from Istanbul and all
oh my God,
hairlines right down there, which may look okay when they're 20, but I don't know.
It doesn't even look. I've seen several of these patients, and you can't even fix most of them. Yeah. Matter of fact, I'll show in the course a couple cases where they got what I call the orangutan hairline. Yeah. And you literally have to cut out their scalps. It's a major thing. These people are mutilated. Yeah. And it's very upsetting. And yeah.
There's some things that you don't want to get the cheapest thing, even you fly in this herky and all this other stuff. And eye surgery and hair restoration.
I was very fortunate in my career. I saw very few patients that were seeing me and questioning costs. And the reason is they wanted a good result. Yeah. And they knew they were going to live with this the rest of their lives. Yeah. And it's so sad when you see some of these people. Some you can fix, but the biggest problem I also saw is over harvesting the donor site. And once you do that, there's very little you can do.
Yeah. Well, it's been great. Thank you for taking the time.
I've enjoyed this.
I know you and Dr. Melissa have a course where you're going to be teaching doctors how to do this, and you're going to be doing live surgery, I think.
Yes.
Well, so that's going to be very exciting. That's happening in Nashville. I think they could go to the SmartGraft website if doctors. I think there was a few spaces left if doctors wanted to join you guys for that experience. I look forward to seeing you again and talking to you again. Thanks for taking the time. We
This
learned a
was
lot.
fun.
We learned a
Take
lot.
care.
Thank
Bye-bye.
you. Bye. I think we've stopped the video. This is the technical portion. Where the and let's see. Oh, he went off. Okay. We finished and I put stop video and it usually,
Pops up with something?
yeah, it'll like.
You said stop recording, right? Or did you exit from the Zoom meeting?
He exited from the Zoom meeting. I don't know why it.
For some reason, it must have transferred the.
Says in Zoom.
Yeah. So he exited the Zoom meeting and it stopped it for both of you?
Yeah.
Somehow you transferred the host status to him. Same Zoom meeting.
Oh, is it still recording?
Oh, yeah.